And welcome to this educational webinar series. I'm Marketing Manager here at FormFast, and I'll be your host. Today's session is entitled The Future of Healthcare. We'll be discussing some of the challenges that hospitals are currently facing, predictions for the road that lies ahead, and how Health IT can help shape a hospital's success. Before we start, there are just a few items to review. First, your thoughts, opinions, and questions throughout the event. Please submit them in either the Q&A or chat panel on the right side of your screen at any time during the presentations. We'll then present them to the speaker at the end of the session. So note the audio for our meeting will be broadcast through your computer speakers. If you have problems hearing the sound, send a message to the host, myself, so we can approve you to join the teleconference. Once connected to the teleconference, please make sure your computer speakers are muted, otherwise you might hear an echo. Today's agenda will start with a presentation from noted healthcare futurist Jeff Bauer. Then Director of Product Management Sean Curtis will share some of the ways that we're working to empower the hospital to be able to cope with some of the costs and compliance challenges that lie ahead. Following presentations, we'll move into the Q&A portion of the session, and finally we'll share some information on our next educational webinar. This is to introduce our first speaker, Jeff C. Bauer, PhD. Bauer is known as the Health IT futurist and a frequent contributor to a wide variety of industry publications, including the Journal of Healthcare Information Management. He's published over 200 articles, books, and videos on healthcare delivery. His book is entitled Paradox Imperatives in Healthcare: How Efficiency, Effectiveness, and E-Transformation Can Conquer Waste and Optimize Quality. And we are pleased to have him join us. Welcome, Jeff. Looks like we have lost audio connection with Jeff. We'll give him just another minute to get back on the line there. He's connecting remotely.
Aaron, can you hear me now?
There he is.
Yeah, disconnected. The wonders of technology. It's the second time it's happened. But rest assured, those of you who have joined us today, that if I get disconnected again, I'll get right back on. I don't know what the glitch is. But is it fair for me to go ahead and proceed then, Aaron?
The floor is yours.
Oh, because I missed probably 30 seconds of your introduction as I had to dial up again. But I'm delighted to have another opportunity to work with FormFast. You'll hear my enthusiasm for the neat things that are going on in response to, as the first slide says, the uncertain but exciting future of healthcare. I have been in the health industry as a medical economist for over 43 years. And I've spent about the last 25 of those years being a futurist, looking at a crystal ball and trying to figure out where healthcare is going. And if one word summarizes everything, it would be uncertain. But in face of uncertainty, I think we have some excitement. We have opportunities to change the ways we do things, to head in different directions. And so that's why I'm pleased to have roughly 20 minutes here to give you my overview on the challenges and opportunities for information technology professionals. And then to stay on the line as Aaron and Sean Curtis tell you a little bit more about FormFast's involvement in meeting those challenges, some great opportunities that are there, and then engaging in dialogue. But in the context of the uncertainties that are out there, I remind you of the phrase that we've heard consistently for the last several years. At the top of this slide, you see the statement, the status quo is unsustainable, really. I've been hearing that, quite frankly, since the late 60s when I started doing my first work as a medical economist, and Medicare was already costing about twice what people had thought it would cost only a few years earlier when the program was established in 1965. So this idea of healthcare spending being out of control, skyrocketing costs for hospitals and doctors and drugs, that's something we've heard before. But is it a case of the little boy who cried wolf, or finally caught up with us? And I really believe it's finally caught up with us. That's why the people are not crying wolf lately. The point is we simply can't spend any more. And the data here on this slide, which may be a little small, but I'll summarize them for you, are the numbers that I presented when I had the pleasure of speaking on this topic at the HIMSS convention in Las Vegas about 6 weeks ago. And I chose not to update these slides for today's presentation because, quite frankly, the numbers even look a little bit worse, and I don't want people to leave this conversation in fear of what could happen. Only fear if you decide nothing's changing, but if you accept the changes that are here, I think good things can happen if we respond appropriately. And the first of the newspaper articles that are on this slide talks about the decline in income. We have been spoiled by growth, and in fact, it's that growth in American income from the 60s through about 2008 that allowed healthcare to grow from 4.5% of the gross domestic product up to 16, 17% where it is now. But the growth in income has stopped. The 2008, call it ongoing recession or whatever negative economic term you want to apply to it, has really hammered Americans. And so the net wealth of the income that a typical American has to spend on all of the things he or she buys has slipped back almost to where it was 17 years ago and still seems to be declining. To the right of that, you see the decline in the number of people with middle income and the increase in the poor and the affluent. And then the lower left slide, the lower left article shows the costs of coverage going up. Healthcare has been going up, and as you see in the left part of that lower left part of the slide, the amount that employers have paid has been going up. And then you look at the right half of that slide, and you see that the number of employers that are providing health insurance has dropped. And just since the 2000 recession, at the beginning of the recession, the 2008 recession, roughly 70% of all offered benefits, and it's dropped 10%. And the latest estimates are that as we continue to see rough economic times, that it may even go below 50%. Then you see that recession is holding down health spending if you go to the right of that. And here the numbers have actually gotten a little bit worse. The Wall Street analysts are even beginning to realize that hospitals and medical groups and drug companies are seeing declines in their sale. Why? For the pure and simple reason that employers are decreasing their coverage and people don't have money to pick up the tab. Then you go to that little chart above that, the farthest right in this slide, and you see that the rate of increase in health spending is declining dramatically. The left peak there at about 15% is 1980, and then we went up to actually 16% in 1981. And that means that between 1980 and 1990, healthcare spending went up 16%. And we're used to health going up more than anything else in the economy. With that, and you'll see that last year health spending only went up about 3%, and we're clearly on a downward trend. So I don't want this to be gloom and doom. I think this is, if anything, just final reckoning for us to realize that we in the healthcare delivery system have been insulated from the real economic factors, but that insulation is no longer the case. And that's flipped to this next slide, illustrating the point that the status quo is unsustainable, really. And that's a point I made back in a book I wrote in 2008. As a futurist and as an economist, I spent a lot of time in the process of writing this book, predominantly in 2007, the trends, and I decided that there was the coming train wreck. I certainly wasn't the only person that was predicting that. As an economist, I was one of many, probably even approaching consensus, say that we had a big bubble, the housing problem, the credit markets were out of control. So there was a lot of belief that the economy was slipping into the doldrums. But most people were quite surprised when I said that would affect healthcare. And so if you wonder if I'm a good futurist, I point with some pride, but not with any satisfaction. And I hope that distinction is clear to the fact that in 2008, I said healthcare spending would peak at about 17% of GDP in about 5 years. Well, that's next year. And to go back to the last slide that I showed you, that one on the right, you see the decline in healthcare spending. It really is moving towards being a no-growth industry. So I feel even more comfortable now, not any delight. I'm very sad to come to this conclusion, but I learned long ago when I was originally trained as a weatherman, I had to call the forecast as I saw it, that we in healthcare, much to our utter amazement, are now a no-growth industry. And that, of course, means that we no longer benefit from the freedom that we had in the past to keep raising our prices because the marketplace would pick up the tab. No matter what we charged, people would pay it. I feel very comfortable, and I think more and more people are coming to the conclusion that solid line showing healthcare spending peaking at 17% of GDP is the way we have to approach the future. Now, it's not gloom or doom, because anybody making 17% of the GDP has enormous resources to draw upon, and I really think our challenge within healthcare is to do the best that we can. However, before I talk about the things that we can do and the neat role that FormFast plays in that, let me tell you why I believe that we can't rely on reform to do that. There's so many people say, well, if we just let Obamacare play out, it'll take care of the problems, but that's not the case. The first bullet under my assertion that reform laws can't solve providers' problems is that we had a very rushed legislative process and a flawed legislation. And at that point was endorsed in spades even by two very liberal members of the Supreme Court just a couple weeks ago, when the arguments for and against the mandate to buy health insurance that is really the cornerstone of Obamacare. And two of the liberal justices said, listen, I've tried to read the 2,800 pages, and I nor my interns have the time to go through this. It really does look like a bad law. And even one of them made allusion to the two comments that the Speaker of the House, Nancy Pelosi, made, where first said, well, we have to pass this law to see what's in it. And the day after it was passed, she had a press conference and said, well, there's a lot of bad stuff in this law, but over the next 2 years, we'll simply make the amendments to change it. We had to get it taken care of now for some real political problems, which came from the death of Senator Kennedy and the fact that a Republican was appointed to take his place, and therefore they couldn't change the law in the Senate anymore. So that immediately started what we see in the second bullet, the legal challenges, and because of the publicity that the legal challenges got in the coverage of Supreme Court arguments a few weeks ago, I don't need to go into that. But when you've got a total of 24 states filing federal lawsuits against the law, it's certainly not the time that you're going to see anybody trying to change it when the whole thing may be thrown out. And indeed, there haven't been any of the efforts that Speaker of the House Pelosi said there would be to improve the law. And the law itself, as this third bullet implies, really gave a lot for the administration and Congress to do, particularly the Secretary of Health and Human Services, but it didn't give Secretary Sebelius any more money. So neither the White House nor the Congress has the money to complete all of the tasks delegated by law. In fact, in the 2,800 pages of legislation, there are several hundred examples of the Secretary shall designate the regulations for this, shall define how this program will be implemented. And this in a time when federal employees are being laid off to meet budget deficits, it simply doesn't compute. And so what we see in the 2 years and roughly 2 months since the reform laws, Obamacare, were passed, is that the Department of Health and Human Services, Secretary Sebelius and crew, have responded to the challenges of implementation by issuing waivers. Last I counted, there were over 3,000, where someone said, if you implement the law, I'm going to go out of business, and the Secretary said, oh, fine, you're exempt. And then there have been enormous delays. Not a single program has been put online at the date, at the level as defined and required by the law. And several of the programs that were to be done according to the law have simply been canceled or delegated. The long-term care provision that should be well underway for implementation now, the Secretary and the White House simply said, we don't have any money, we're not going to implement that part of the law. And they also have, as you know from being health professionals, many of the other programs. So it's not a very certain environment. And that means that really, in effect, we've delegated responsibility for implementation to the states. And I don't care what state you on the line are from, I doubt that your states are dealing with any surplus to make up the difference. In fact, I live in Illinois, and this morning's Chicago Trib front page talks about dramatic increases, up there in the 10-15% next year in state support for health programs like Medicaid and some of the Medicare programs. So because the feds are out of money, they've delegated much of this, particularly now the designation of the basic health plan, to the states that have no money to do it. The train wreck starts looking pretty likely. So I put the next slide as a example of how complicated the legislation was. I'm sure all of you on the line attended more than one conference in 2008 or 2009 after Obamacare was passed, and you saw this list of all the things that were going to be implemented, and yet I've already shown you, and I'm not being heretical here. You all have seen the cancellations and the delays and the like and the state problems. These things simply aren't happening. So I've used this slide for years, and it leads now to the more optimistic view of what we can do with 17% of the GDP. I think we, by and large, have been like the gentleman looking through the telescope, and we've been assuming that our focus on Washington would bring things into clear perspective, and if we'd simply play the game, we'd get the money. I started out as an economist saying that the money isn't there, and I think that's now clearly a consensus position. So I'm not out on a limb anymore, which I was when I originally wrote it in 2008. Now I'm like the lady on the left of the gentleman looking through the telescope saying, you spend too much time looking in the wrong place. The real excitement is this comet over here. There's something going on. So for the last few minutes that I have here as my bridge to Aaron introducing Sean and then us engaging in discussion of what can be done, I want to talk about what progressive providers can do. And reform problems, obviously the healthcare delivery sector has problems, but if we replace our traditional operations, which have led us to this constant increase in our expenses and the like, if we finally get serious about becoming efficient and effective in the way we produce our processes, independent of government-directed reform, we can do some neat things. And there's example after example out there of good healthcare delivery systems that have become efficient. And efficiency, I won't ask like for a show of hands, I can't see you, but I do that often with audiences. If I remember back to your Economics 101 class, or probably more advanced economics classes you took when you got your master's degrees or even your own doctorates, you learned about efficiency. And since we have a fixed budget, that first half of the definition is the only relevant one, is that we've got the fixed budget to 17%. I can't imagine any of you are in organizations that are looking at increases in your bottom line operating funds for next year. So the issue is to maximize the output, and that means, in purest, simplest English language, no economic waste. We've got to eliminate the waste. We also have to become effective, and that's because the people that pay the bills, the government and the employers that have provided health plans to 70% of the 70% of companies in this country that have provided health plans, they want to see effectiveness. They want to know that you're complying with your objective specifications, that they're not getting shoddy products. And I've attended no shortage of business group on health meetings over the last couple of years where executives of Fortune 100 companies have stood up and said, we finally looked at the quality of the product we're getting for our expenditures on health care. And for those companies, healthcare is the biggest single expense. The automobile companies pay more for healthcare than they do for the parts of the car, for crying out loud. And the people that pay the bills have said, we're not going to pay for shoddy care. You all know that Medicare has said there are things we don't pay for at all. There's the no list. So we have to become efficient. We have to become effective, meaning define what our product is going to be in order to survive, but I'm firmly convinced we can. And the key, and it's been in all of my writings and consulting work I've done over the years, and I can point to lots of other people that I respect as other health economists and consultants, really boil down to this is our challenge now, doing it right all of the time as inexpensively as possible. So we have to become effective, meaning that we use our data systems, look at our numbers in a different way to make sure we're not committing errors, because we're increasingly not going to get paid for errors. And then once we make sure that we're going to get paid at all, then we have to perform as inexpensively as possible. That's why I really think that if we get progressive, if we change our business models, we can do that. And that means we have to capture our wasted resources and reallocate them to productive uses, as you'll see at the top of that slide. Now, do we have wasted resources in healthcare? Part of the book I wrote 4 years ago, Paradox and Imperatives in Healthcare, very clearly referred to what were then about 35 to 40 articles, and it's now in the 50 to 60 range. Work done by the government, by private research organizations, by respected economics departments. I'd say we're now up to close to 50 articles that consistently show in peer-reviewed journals, when they put the money that's spent in healthcare, that 25 to 35 cents on every dollar we're spending in our typical healthcare organization is wasted. It's not doing anything to improve the health of a patient. It's not doing anything to improve the health of the country. And indeed, when you look at the list, and I put this list in red to show that this is deficit, accountants put losses in red, and these are our losses, just right at the top of the bat, the things that we do incorrectly because people aren't properly trained, or the things that are done unsafely that lead to being made worse off, and that's why the federal government has gone to the no-pay list, the things that they won't pay at all. Is, it's never the fact that a patient is re-hospitalized as a result of something that was done incorrectly or unsafely in a hospital. It's sort of unconscionable to expect the government or any other insurance company to pay for that. So, and that accounts to a big part of that, 25 to 35 cents on the dollar. Or we might do correctly, the drug that was administered absolutely the right way, or the surgery that was performed correctly. So, on books it looks like it was done correctly, but that second bullet shows that it was unproductive or counterproductive. There's a growing list of things, and recently they've been emphasized even in Consumer Reports in conjunction with 9 of the largest medical specialty colleges, showing that drugs that people take that don't make them better off, or surgical interventions that were a waste of money because a drug could have done it, or even physical therapy. So, and that the size of that list, the dollar value of things that are known to be unproductive or counterproductive, is growing. So we use our data systems, better analysis of the numbers we've got, and that's why I'll turn it over to Aaron and John in a minute to talk about ways to get better control of our numbers. That's that's what we've got to do to recapture the 25 to 30% of the income that we're getting and spending now in order to survive. We do that by making our care consistent with best practices. It's in red here because we all know there are lots of things that we don't do the best way. We look at the medical staffs in our hospitals and find 4 or 5 different procedures being done. Well, one's got to be better than the others, and we need to find that. We find the least expensive resources. We've got to substitute practitioners for physicians when a nurse practitioner can perform the procedure. We've got to use drugs rather than surgery. We've got to use outpatient settings when it's not necessary to put a patient in there. And really, we're just tipping the iceberg, getting to the iceberg there. Titanic, I guess, image coming to mind with all those celebrations over the weekend. And again, we need to look at our data, get those numbers operational for us right away, and that way we can overcome the poor utilization of our facilities. And next to bottom bullet there, deal with the perverse incentives of the reimbursement policies. Insurance companies are absolutely on the line here. This is not something that can be solved by the providers alone. I've been very clear that the only way we're going to solve this is if we start creating partnerships of the payers and the purchasers and the providers, and quite frankly get the patients involved with a little of their skin in the game, because insurance system is a big part of this problem too. And again, that points to the data, the need to look at workflows and things I'll talk about in the segue in just here in a second. And that balance between acute care and disease management. And I'm still an old medical school professor at heart. That's how I spent about half of my life teaching statistics and research in medical schools. And so I follow this pretty clearly. And when I look at the medical science today, the big shift between 20th century medicine, where we could keep seeing those annual increases in spending on healthcare, and what we see today is suddenly we know why an awful lot of diseases occur, and we realize the issue is not waiting until the disease is fully apparent. It's managing the patient, giving them the right drugs, helping them do the things to prevent ever needing to come in for that heart surgery. So there's some pretty exciting things. But to lead this to my final 2 minutes here, when I was writing the book 5 years ago, 2007, you might remember that gas was very expensive and SUVs were sort of discredited. And so when I wrote the book, one day I was running in Lincoln Park near where I live in Chicago, and I saw that SUV. And I said, that's my metaphor. We're driving around. Healthcare is going everywhere in an SUV. It's a much bigger vehicle than what we need. And so imagine, and this is what I really saw. This is not Photoshop. This is what really saw. This was my eureka, my moment of inspiration, when I realized that a lot of times we could substitute a smart, we could substitute a motor scooter, and get there a lot quicker at a lot less expense and just as safely. That was really what the key was all about. So, I want you to embed this picture in your mind. We're in SUVs, and the issue now is to become as efficient as possible. That's really what I've tried to focus on in my articles. I've written the lead article for every issue for the last 11 years of the hymnal. It's a real quick segue. I'll just walk through these. These are available to you. That was on the newsstands at the time of the hymns just about 6 weeks ago, was we need to move beyond high tech. It's not just an issue of finding how to harness our data systems for becoming a meaningful user. It's looking at our workflow, and we need the interface solutions. We need to get off the paper trail and make our data available to all the people that need to see. That's a lot more than just being a meaningful user. So the point there is that we need paper. Some things are going to be better recorded on paper, but we need to make the data operational as quickly as possible. And that means getting it from paper records into databases that can be searched, can be used by lots of people. And that's an exciting thing that Aaron and Sean will tell you about in a second. We need to be doing our comparative effectiveness research, going back an article or an issue or two before that, where I wrote up the need to, since we're wasting so much money on inappropriate procedures or too expensive drugs, we need to be able to harness our databases. Again, look at the workflow to find out where we're administering certain procedures quicker than we need to, where we're using a person or a health professional that's more expensive than another one, and that means comparative effectiveness research to see what we're doing. We need to have our dashboards, and a really exciting thing when FormFast originally called me, and I think they'd seen my article on dashboards, and that's one of the neat things is in their bag of tricks is again operationalizing their numbers, looking at workflow issues, getting the numbers from the paper onto the databases that we can analyze and do real-time stuff to see, to use our dashboards to find out where we want to go and to make that recovery of the 25 to 35%. But we can't do that with our existing data approaches. We've got to. And so an article that I wrote in between those two I just showed you is we need meaningful return on investment. And that's going to be a lot more than just adopting electronic health records. It's going to be finding what. And then, but not least, is leaders, in the information world, which is probably a lot of you. I'm sure many of you on the line are high-tech executives. The leaders and say that really where we're going in healthcare is key to help people become efficient and effective and go far beyond the to really having the people responsible, our health experts and our information technology experts, really leading the way to say let's operationalize our numbers and get them off paper, get them out where everybody can see them, find the numbers that are important, because that ties us back to my very initial point that the buck has stopped. We've got to become efficient and effective. We're sitting on the data that could allow us to do it, but we don't do a very good job translating those numbers into operational changes in our workflow, becoming efficient and effective. And I'm happy to turn it back to Aaron, who will tell you how we'll carry on the conversation.
Thanks, Jeff. Great presentation. Brief reminder that our Q&A session will follow both presentations. Feel free to submit questions at any time during the session. Now I'd like to welcome our Director of Product Management, Sean Curtis. Sean will share part of FormFast's vision for the hospital of the future and how our solutions are helping them reduce waste, use data effectively, and do more with less. Sean?
Thanks, Aaron. If you can pass the presentation all over to me. All right, thank you. So Jeff brought in a lot of good concepts and great ideas. Thanks, Jeff. We've worked with Jeff in the past, and really what brought our attention was, his insight into the market and the ideas that he had as to how to improve hospitals, because FormFast is about performance in the hospital and making hospitals the high-performance hospital. So what we do is hospitals to improve their processes, that's in a department or whether that's across the enterprise. We bring process and technology to simplify these processes in an easy way and give them tools, give you tools to make that something that you can continue to build on and grow with, and improve your processes through, as Jeff said, knowing the data and then working towards effectiveness and efficiency. So the way to improve processes is by providing a technology that lets you take a familiar interface that you're already using and turning that into something that's electronic, and not just an image of something that's electronic, but actually something that will be captured and used and moved across your organization. We also give you the tools to make that design easy to work with, so you can actually change this as you need it to. As you learn about the process that you're doing, you can report and record data and then understand that process and design and redesign. And it's also an interface that your users are used to. It's easy to use. Basically, if you don't know FormFast, what we do is take your documents and make them web-enabled, make them online-enabled, make them on-demand-enabled. And not only that, but give you a way to create new applications simply and easily. take that paradigm of a simple and easy interface that you have full control over and add to that the ability to create data that capture information and do workflow, moving that across your organization. It's going to integrate with existing systems, integrate with the work products that your people are already using, so they understand how they do their job, and going through these simple, familiar processes isn't that big of a change, so it has a great adoption curve for you. Apply this in different areas, those being the department. There's a different need in the department compared to the enterprise, compared to the individual. So inside of a department, using our technology, you're going to be able to control your processes, understand what is happening within your department, within the realm of responsibility that you have, a dashboard of outstanding processes. Maybe it's patients in your queue that you have to work with as a case manager, or maybe it's financial related information, coding hits that aren't being processed in time. So we can give you a dashboard so you can see those different processes and where things are happening. You define the business rules that those processes are prioritized based on timelines or dollar amounts or different types of treatments that you're doing. So this gives the management team the insight into your department, what's happening, where the inefficiencies are, and how you can then look at that and start improving that, working more effectively, working more efficiently, going into Jeff's message, and using that data to improve your processes and become more efficient. Taking that up another level into your enterprise, and your enterprise would be the culmination of all your departments, all of your clinics, your physicians, labs, everything across your entire organization. Taking that same technology and then building that out, sharing those dashboards upward through the organization so that you have key performance indicators across enterprise goals, and you also have shared information across departments. Products is scalable so that it can fit any process or go across departments and work across your organization in different locations. It can be customized to fit any needs. So basically, grow through the process. You're going to take paper processes or manual processes, replicate those with technology, and then improve those and customize those to fit a new paradigm of an automated process. And as Jeff said, taking the least expensive resource possible to do the job that's needed, a lot of time that is going to be technology. Putting in a repeatable automated solution into play rather than adding people to the process may be your better solution. So that's one of the ways that we help as well. So FormFast see as the evolution and what are we building our product around? What are we doing? This is our material, and what it's talking about is the evolution of hospitals going from the path of very manual processes, paper heavy, a lot of parts moving around the hospital that are not really shareable, they're not integrated with systems, difficult to use, moving up there to a paper light organization that eliminates a lot of that paperwork, turns it into electronic, using electronic medical record systems, automating the process, eliminating things like pre-printed forms and doing logic-based or on-demand printing where needed, so you're still using some paper, but you're able to eliminate a lot of that or integrate the information on the paper into eForms. And then at the top pinnacle of that pyramid, working about paper-free, where we're really able to enable all of your systems with paperless solutions, automation, and content that you're collecting and gathering through your organization and being able to share that across your organization. So the tools we use FormFast, basically we have an entire portfolio of applications to get you from wherever you're at on that maturity model up to the pinnacle on that maturity model, if that's where your goal is to go. And of course, as you move in that direction, your efficiency and your effectiveness will also increase because of the sharing of information, the reduction of redundancy, and the introduction of automation. So some of the solutions that FormFast offers in its portfolio include capture, which could be data capture, so you're capturing information at time of registration or through other applications. And again, this isn't just clinical information or clinical tools. This can be a business set of tools for finance, for HR, for operations, and for clinical processes. And it goes across the board. I'll show you that in the upcoming slides. But capture refers to being able to capture images of documents and store and distribute those, capturing data so that you're capturing the actual information that's on forms. A lot of you may be using forms now, but that is in paper and has to be basically keyed back into your system. So if you're putting that into an online form, you're able to capture that granular data. Then the next is, of course, the workflow product, where you can take that and define what the workflow is for this process, and then automate where it can be automated and distribute across your organization. We can give a tool that can be flexible with the automation of workflow to you to capture that content. So part of the workflow's job is to get the interfaces in front of the people who need to provide the information. Also the systems as well, so there's integration there as well. And content management. So once you've captured data and it's been through a process of workflow to gather more data or approvals and requests and things like that, then you have generated content, and it's electronic content, and it's content that can be managed now in a content repository that can be shared across your organization and can also be integrated into other solutions so that other areas of your organization can capture, can view, can leverage the content that's been created or captured. Leveraging, another way of leveraging all of this is through the analytics, being able to report on the data that you've captured in these processes, the time it takes to complete these processes, the types of content that you're creating or managing. Being able to analyze these things will give you greater insight into your organization so that you can, of course, understand what your processes are generating and then what your timelines are on those processes so you can start improving those. And then input management fits right in there as well as far as capturing information, determining the proper workflow for that information, and then how that output and where it is output. So what is defining just more and more of the workflow. These are all different ways the workflow kind of is centric to this picture, and you're capturing it, you're moving it through, you're organizing it, and then you're being able to output that in a variety of formats. So again, I said this isn't just a solution for clinical. This is a solution that is going to be able to affect change across your organization. I see comments coming in about change management. Of course, yes. As you're doing change management and seeing the change, the results of the change, basically you're starting with a theory when you do a process redesign, and then with the analytics and the reporting and the data that you're capturing, you're going to measure your results of that change and then modify that and control and meet the goals that you're setting for both your department and your enterprise, your organization. And across the board, so we're talking about all of these areas being able to affect all areas with this technology. Sorry, somehow my slides have jumped around on me. So be able to affect compliance, do solutions that have the administrative side, your HR, your revenue cycle management, all those types of things. Of course, one thing I didn't mention in the slide in the past was capture also can include capture of electronic signatures, and output can include output of admission documentation, discharge orders, all of those types of documents that are output for your patients as well. As we're talking about change management and process improvement and process management, of course, FormFast is somewhat rooted in ideas of both Six Sigma and Lean. So being able to take one of your processes, whether you choose Lean or Six Sigma, and being able to work with FormFast to enable that new process, automate where we can, and then apply this continual improvement or whichever Lean or Six Sigma process you do apply, being able to use this as a tool set to make some achievements in process improvement. If you have a process improvement organization or a process management office, it's a great tool set for that group to start automating some of these different processes that will help you get to that pinnacle, get to that high-performance hospital that we're all striving for. Again, we're tying back into the messages that Jeff has talked about. We have a platform for action. We have a platform that's going to affect change across your organization. And we really have paired up with Jeff just because we have such a synergy in our messages about how we can make this come about and the responsibilities of hospitals and organizations to look at their processes and start improving. And FormFast wants to give the tools to you so that you can start making these improvements and striving towards that and meeting your organizational goals. So with that, I'll turn it back over to Aaron, and we're going to start the question and answer session.
Very good. Thanks for the presentation, Sean. A couple of questions for you and Jeff. One question for Jeff. What are some of the biggest areas that you can improve to reduce waste?
I think your phone is muted.
Can you hear me?
Yeah.
I didn't touch the phone at all, so this is the system that's playing games here. Yeah, you're talking economics to go where the money is, and the biggest money is in personnel. So I think the first place that we need to look is the fact that 60 to 67, 68% of every dollar we spend in healthcare goes to personnel. So we need those numbers, and they're the number elect because I came and kicked the tires at your shop in St. Louis before I agreed to do the engagement, and we need to come in and look at those numbers of personnel and find out where we're using someone who is either being inefficiently used, has too much on his or her plate, or that's perhaps doing the job fine, but you're paying $50 an hour for a job that could be done by someone whose net cost to you is $20 an hour. First place to look, of course, is personnel. A very close second, however, that ties nicely to the personnel is just the workflow processes themselves. Inefficient personnel expenditures are almost always a case of two people being in a process when one could do it, a form having to go in front of 6 different people, or a form that doesn't have a standardized way to work its way through for budgeting and purchase, or for moving around a hospital. I mean, it can be almost anything where we've got a data flow and we have people. And so often, each individual person is being efficient. You've got 2 people being efficient when one person being efficient could do the job. So look at your personnel, look at the ways your people respond. And one of the neat things that I saw in looking at your databases and the way you go in and help people identify workflow is to eliminate that redundancy and then to make sure that the numbers go to the right place. A third and rapidly growing thing is our pharmacy spend. Actually, I've been to 2 conferences, one each in the past 2 weeks, looking at pharmacy, and people really beginning to realize that we're probably prescribing far more drugs than we need to, or not prescribing some drugs than we should. Interestingly enough, today's New York Times has the science section in it, and I managed to get that read before this course started. And there are, I believe, 3 different articles in today's New York Times Science section about spending on pharmacy, in terms of overdiagnosis or overprescriptions and the like, and that's now at the national thing. So we need a much better look at our pharmacy flow. And again, that's the kind of data thing that Sean was talking about. That's where you remember that little circle he showed. We need to get a control over how much we're spending, where the drugs are going, whether we're making sure that they're not duplicating, whether the patient is benefiting from them. So, Aaron, I hope that answers your question. But personnel, workflow, and drugs are big ways to start recapturing that 25 to 30 cents on the dollar, 35 cents on the dollar.
Perfect. Got another question from Paula about if your presentation will be available. It will send out an email following this session with that presentation, so you can print that and review that, as well as a recording of this webinar, so you can review that or pass it on to someone else in your organization who might benefit from it. Sean, a question for you, a question about how we integrate with other vendors.
We integrate on a lot of different levels. It depends on what type of vendor it is and what the goal is. For our output automation, we can take data from basically a print stream and reformat that into a set of documents that can be output to either a system, such as an archiving system, or to a printer, or to a fax, or to an email system. Intake the data as well. So we have a HL7 interface to intake information and basically keep a standard list of your patients updated at all times, so that we have that access to that information, so that we can generate workflows or documents or do our work based on that information and provide that for you. We'll provide for portal integration that allows you to basically use our software through other portals. So if you have a portal for your physicians or a portal for your revenue cycle managers or whatever your portal is, you can also be able to launch into the FormFast products from that, passing the context. So if you're in a particular record, you can pass that context to FormFast and then do the work that you're requesting of FormFast to do, pass it back into that system as well. So it's we have a really open platform as far as integration is concerned, input, output, and as far as sharing information between other systems, we kind of focus on doing that because we understand the environment that you're in isn't one where we want to be moving around between a lot of applications. Really be able to do that through a set of applications, and whether FormFast is that frontline solution or if they're the solution that is behind the scenes moving through the workflow for you to supplement that application and to fill the gaps, that's where we fit as well.
Very good. And then you mentioned briefly in your presentation about dashboards. As you mentioned, that's something that you've written about and our solution set. I wondered if you could share a little bit more about why you feel like that is an important feature to use in healthcare.
Well, I think dashboards provide us with an absolutely essential focus. We have so many numbers in healthcare. As I say, my main background, I'm a numbers guy. I've spent most of my professional career dealing with numbers one way or another, and I couldn't even begin to guess how many thousands of different data sets and averages of this and patient summaries and the like are available to us. And, it's just a hodgepodge of an incredible number of connections, and unless we've got some focus to know how to sum up all those things, is sort of the bottom line things that we can operationalize for management decisions, we're just intimidated by too many numbers. And the neat thing about dashboards is the whole movement towards dashboards. And this is, it's science now. There really is a science of dashboards. It's figuring out what numbers can you combine, where can you have composite indexes, how can you measure not only your success, but boil it down to the couple of things that are most important. So I love dashboards because they really force us in advance to decide the most important things, the numbers that we need to see to make the decisions for personnel allocation, for investing in new technologies for doing a job with surgical management, what have you. We need the dashboard that takes all these thousands of numbers, takes the measures that are most meaningful and reliable and accurate, and then allows us to see how we're doing on a, most of the dashboard literature is written on a monthly basis, something you show to senior management. I only is the ideal real time. I mean, on an hourly basis you can see where you are, but I've been in lots of hospitals and seen data systems like yours that can do that. But I guess I'm talking more than I need to. Basically, dashboards are absolutely fabulous because they force us to think first of all about what's important, and then they provide the measures that allow us to see whether we're getting where we wanted to be. And in the absence of dashboards, we tend to be just too unfocused, and too intimidated by numbers that just don't make sense unless we combine them.
Perfect. We had a comment from Tim who mentioned that change management in particular is a challenging process. I wonder if either you or Sean could speak to ways to improve that process.
Sean, go ahead and deal with that one first.
Yeah, I touched on it, and I know Jeff got more than I do, but with with FormFast, you basically map out what your change to your process is going to be. So you map your current, you map your future, and then you're able to measure all the points along that line. So you can take a 3-month, basically look back after you've made that change and see, did we meet the goals that we were attempting to meet, and if so, can we make those even more aggressive, or not? What can we look at based on this data? Where can we make other improvements to meet those goals and keep making those changes, and then growing that out. The thing about the process improvement that we go through, basically part of the defining of the solution, is to look at what you're bringing to us as far as the process, but then also look upstream to see why this process is happening and what's feeding into this process, and then look downstream as to what's the result of this process, and see if we can affect change at a broader scale than what maybe the people who are in this change have brought to the table, and look at an enterprise scale or a larger scale, and lead to greater success by having more stakeholders and more enterprise-wide involvement in the solution. I'm sure you've got a lot to say on that.
I'm glad that what you said was eloquent and right on target, because quite frankly, I'm happy to admit publicly I am not an expert in change management. I need to spend my 40 to 50 hours a week as a medical economist and health futurist just figuring out what changes are necessary, to the extent that just following health reform, following the economy, following the changes in Medicare and Medicaid reimbursement, and what the private insurers are doing. That occupies all my time. So I really have never taken the time over the last 10 to 12 years to become an expert in change management. Rather, I'm the person that says the change is necessary. I'd like to think my strength is saying, surely we will end up where we're headed if we don't change direction, and showing people we got to change direction. But then I turn with delight to experts like you and your colleagues at FormFast that provide the mechanisms, the processes for making those changes. So you're fine to assume that I would have expertise in that, but the reason I'm working with you is we got together because I'm pointing out the need for the change, and I'm excited to find that you and your colleagues have mechanisms, and the fact that you had several change management experts on your staff, that you had peers that I met when I came to visit your offices in St. Louis before agreeing to do this engagement, really excited me, because I'm absolutely convinced of the need for change, and I'm convinced that change can happen, but I'm not an expert, and that's why I need colleagues like you that can show people the tools to do it.
All right.
I think that's all the time I have for questions. I'd like to thank both of our speakers, Dr. Jeff Bauer and Sean Curtis, for taking the time to join us today. I want to take just a brief moment to tell you about our next webinar. Looking ahead next month, our educational webinar series will continue with a session entitled E-Signature, the Missing Piece of the Paperless Puzzle. Join us to learn about how e-signature solutions are helping hospitals realize their goals of being completely paperless in admissions, for bedside consent, and other areas throughout the hospital. Hospital. This webinar will be on May 17th at 11 a.m. Central Time, and you can register by going to formfast.com/webinars. You'll also be provided with a web page at the close of this event with a button that takes you directly to the registration page. If you'd like to learn more about FormFast Automation Solutions, there's a button on the response page to request a meeting to see our products in action. There are hundreds of uses for our workflow platforms. We'd love to discuss specific processes or areas that are difficult to manage to show you how we can help. Thank you for your attendance today, and we'll see you at the next FormFast webinar.
Take care.